Acne, pimples, mostly occur due to hormonal changes occurring in the body. They are most prominent among teenagers undergoing hormonal transition. If someone suffers in these days, it is a social stigma. Today's generation is a selfie generation, so day-to-day pictures make them more conscious about skin conditions. As selfies lead to observation of every little change of face, these youngsters get affected from acne and feel apathy, sadness. These are mainly seen on oily skin, but it doesn't mean it can't happen in dry skin. Factors that stimulate sebaceous glands to secrete more sebum. More androgen hormone secretion. The sebum glands are very sensitive to hormone. Rising of hormone levels cause the oil glands to more enlarge and produce more sebum. Excessive sebum can break down cellular walls in pores and grow bacteria. Unhealthy food habits. Unhealthy food habits like taking of more junk, fast food, fatty foods result in more sebum secretion and acne formation. Faulty lifestyle. Sedentary lifestyle, lack of exercise, irregular habit of taking meals, late night sleep, or insomnia conditions are also one major cause for acne formation. More stress. Staying in a stressful condition, pressurized lifestyle, suppression of natural emotions, either due to situation or by own nature, can put a major impact on the endocrine system, including sebum glands. That can also be a contributing factor for development of acne. The suppression of emotion of any form, like anger, grief, vexation, anxiety, jealousy, all affect the HPA axis, the hypothalamic pituitary adrenal axis, and thus your physical body. Medicines. Some medicines that contain corticosteroids, androgen, and lithium, those also increase the androgen hormone level and cause acne development. Starting and stopping birth control pills can also cause acne. Cosmetics. Greasy cosmetics are also causes for acne. Cosmetics-induced acne generally occur on the chin and the cheeks more than on the forehead. It presents a small whitish bump, sometimes referred to as grains, which are more noticeable when the skin is stretched. Menstrual acne. Acne appears during menstrual cycle because fluctuating hormone levels around this time of menses and sometimes in pregnancy. Family history. Acne have a family history of the disorder. If one of your parents had severe acne, you are likely to have it. Pripion bacterium acne. Pripion bacterium acne is a bacterium that lives in skin and uses the sebum as nutrients for its growth. Sebum secretion makes a suitable environment for growth of P. acne and set up an inflammatory condition and develop acne. Pathogenesis of acne factors interlinked for development of acne. 1. Excess secretion of sebum from sebaceous gland initiates the acne formation. The excess secretion of sebum from the sebaceous gland is influenced by the excess androgen hormone. The excess hormone level in blood stimulates the sebaceous gland to secrete more sebum secretion. The more androgen hormone secretion is indirectly influenced by many factors like high stress level, suppression of grief, suppression of anger, more anxiety or depression, unhealthy food habits, faulty lifestyle, physically inactive. 2. Obstruction of sebaceous follicle swelled up the skin pore and erodes the tissues at the margin of pore that causes more dead skin cells formation. The sebum with the dead cells from soft plug that obstruct the skin pore. 3. The Propion bacterium acne leads bacterial growth. Once the follicle plugged, lower portion becomes engorged and distended with sebaceous discharge and keratinocytes. The Propion bacterium acne is type of bacteria that lives on the skin and uses the sebum as nutrients for its growth. More sebum accumulation in the follicle influence more P. acne bacterial growth and initiates an inflammatory reaction. While the skin pore opening persists closed, That is called a closed whitehead. It is called whiteheads because they look white or flesh-colored. When the follicle enlarges more, that stretches the skin pore, and the content inside gets exposed to air and oxidation occurs. It causes a dark appearance of the lesion, and that is called blackheads. 4. The development of acne dilation of the follicle continues. Its inner content consists of sebum, dead skin cells, released out and spread over the skin. This leakage causes an inflammatory reaction and initiates the formation of the inflammatory lesion papules, pustules, and nodules. And inflammation continues to worsen. Larger papules and pustules created. Acne papules are pink or red in color. Acne nodules are solid, raised inflammatory lesions that are situated deeper in the skin. Different types of acne. 1. Non-inflammatory acne. Non-inflammatory acne includes blackheads and whiteheads. These normally don't cause swelling. 2. Inflammatory acne. Pimples that are red and swollen are referred to as inflammatory acne. 1. Blackheads. Blackheads are clearly visible on skin of face. They are black and appear on the surface of the skin. Blackheads are developed when a pore is clogged by a combination of sebum and dead skin cells. The top of the pore stays open despite the rest of it being clogged. 2. Whitehead. Whiteheads are a mild form of acne that appear as small, round white bumps on the skin surface. This type of acne occurs when a pore becomes clogged with sebum, dead skin cells, and debris, but does not open outside and covered with a thin layer of skin. It appears white on its surface. Whiteheads may appear on the face, shoulders, neck, chest, and back. Papules. Papules are a type of acne vulgaris shown up as small white bumps on the face. This sort of acne happens when a pore becomes blocked with sebum, dead skin cells, and the inflammation occurs. This inflammation breaks down the surrounding wall of the pores and forms bump structures. The skin around these pores is typically red and tender to touch. 4. Pustules. Pustules are similar to papules, clearly visible on the surface of the skin. They are red at their base and have pus at the top, so look whitish or yellow. They are painful to touch. When it comes to pustules, you should wait until a whitehead is visible. 5. Nodules. The nodular type of acne is hard and larger than papules. They are extensive, solid, painful, and nodular-like deep-seated in the skin. These sorts of acne can cause scar formation if not treated early. 6. Cysts. Cysts can develop when pores blocked by a combination of bacteria, sebum, and dead skin cells. But these blocks are deep within the skin and further below the surface than nodules. They are larger than nodules and appear like a cystic structure. They are painful and filled with pus. Cysts cause scars. Treatment. Dr. Mucker, homeopathy, offers a long-term cure to acne. It is because homeopathic medicines target root causes of trigger factors of the disease, thus giving a long-term cure, also keeps person as a whole healthy. Homeopathy considers acne as an expression of the internal process, which justifies treatment at the inner level rather than treating it at skin surface by local applications of creams or lotions. Homeopathy offers splendid treatment in cases of acne, which is effective, harmless, and no side effects. In addition to healing existing lesions, it will forbid new lesions from forming, prevent scarring formation, and also minimize the psychological stress to female as well as male caused by acne. Increase confidence of a person on how he can look and feel internally. Besides that, the acute condition of acne, like the pain, inflammation, swelling, that are well treated by proper homeopathic remedies. As discussed, excess of androgen hormone, blood plays a major role in acne. The excess of hormone secretion caused by many triggers. The major factors lead to trigger hormone secretion are various emotional states the person is passing through in his or her life. There are emotional states the person is going through during his life, such as grief, anger, agony, anxiety, fear, depression, etc. When anybody suppresses those emotions, like suppression of anger, suppression of grief, suppression their desire, those all directly affect on the neuroendocrino immune path, which disturbs the harmonious function of endocrine and immune system. More androgen secretion is somewhat related to suppression of various emotional factors of the patient in the present or past life. More sebum secretion means more acne formation. Long-term curative effect is it is highly required to consider all of these emotional factors of the patient, which are somewhat related its developments. Hence, the treatment based on this emotional suppression can help to maintain a normal, healthy endocrine function. Only the homeopathy treatment that targets the different types of suppression of emotion and thus helps to regain back the healthy endocrine function and thus maintain healthy physical state. Various emotional suppression, there are different homeopathic remedies. Homeopathy has no fixed medicine to all acne patient because there is not a single emotion expressed by all people. Thus, a homeopathy medicine is selected individualized basis, emotional picture suppressed in life. Dr. Mucker medicine is able to give a long-term cure to the acne problem individualized treatment. Homeopathy has an exceptional proven safety record with the FDA, with 200 years of clinical effectiveness.